Broadcast.
Hi, everybody. We are here. It's 6 p.m. Friday in conversation, and I start now. India is the youngest country having most number of people under 50, yet approximately 35% population suffers from hypertension, of which 25% is urban population and 10% is rural. Hypertension or high BP is the one silent killer that has long been recognized as one of the major risk factors for cardiovascular disease and premature deaths worldwide. Hello, everybody. You are in conversation with Archana Malhotra. In Conversation is a platform of learning and sharing about human values, growth, and global impact. We plan to bring for you achievers and change makers from different professions to share their knowledge and experience. Today, our guest is the chairman of Clinical and Preventive Cardiology, Medanta. With a career spanning over 4 decades, he's a mentor for Diplomate National Board of Cardiology Fellows and trains physicians from all over the world. Amongst the more than 200 national and international awards, he's also received the prestigious Dr. B.C. Roy National Award in 2004 and two more awards by late President Dr. APJ Abdul Kalam. He is Dr. R Kasliwal. I welcome you to In Conversation, Dr. Kasliwal.
Thank you very much, and a very good evening to you. I'm really honored to be here in conversation. Thank you so much.
Thank you. We welcome you again, and we have two major topics to discuss today. Both are as important: hypertension, which is one of the main causes of deaths in India, as I just discussed, and one of the main causes of hypertension, that is stress. How you respond to stress, especially now during the COVID-19 pandemic, can depend on your social support, your financial situation, your health, and your emotional background. There are many other factors also, but stress causes dramatic temporary hikes and spikes in your blood pressure. And that is what we are going to discuss with Dr. Kasliwal. So, Dr. Kasliwal, what are the symptoms of high BP and when should an individual seek immediate help, as in how high is too high and when do I need to rush to the hospital?
Yeah. So firstly, you've started it very well in the sense that stress is one of the risk factors for high blood pressure. How do we define high blood pressure? If the home blood pressure monitoring is above 130 by 80, and if in the doctor's office or generally your blood pressure is above 140/90, then we say this is hypertension. It is very important to define hypertension. This is the definition of the Indian Society of Hypertension, as also the definition of the European and the American and the European Society of Hypertension. As Archana ji asked me, what are the symptoms? Now, that is why the paucity of symptoms is why this disease is called a hidden killer. Many times, the only symptom we actually have is heaviness in the head, or very importantly, sometimes when we get up in the morning, we get up with an ache in the back, or we say, look, we haven't slept well, we're not feeling fresh. Sometimes we get giddiness, shortness of breath, and sometimes we find that there is a chest discomfort. These can be, but as you can see, these are extremely non-specific. This can occur in many diseases, and therefore we have to be cautious about it. As Ms. Malhotra very nicely said, that we are a country of the youngest people in the world. So what is stopping us? Women over 25, men over 30, what is stopping us? I'm sorry, men over 25, women over 30, what is stopping us from getting our blood pressure checked up? It's as simple as that. And the doctor will say, okay, the pressure is normal, or it's slightly elevated, and then you can take it again. So this is one investigation in which there is no needle stuck in your body. You don't have to be prepared for it. You just go, put your hand down, and somebody takes your pressure. The best is to take home blood pressure monitor and say, this is what my pressure is, and be happy. But sometimes, Archana ji, this is a good question. that when a patient comes with some intercurrent infection, the doctor says, look, your pressure is 180 by 90. Didn't you ever know that? No, 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 sir. I used to get some headaches. I thought it was stress related. I forgot about it. But this can result in strokes, this can result in heart attacks, and this can result in kidney damage. So that is the importance of absence or near absence of symptoms, which we can take care of by getting our blood pressure checked up. Simple as that.
Dr. Kasliwal, I want to also add in here that mindfulness is very important because mindfulness helps you focus on the present of where you are now, how your
Hmm.
body is reacting, being aware of yourself, your body, your mind, your thoughts, and so that you can, if you're aware, you can seek help right away. You can rush to the hospital, do whatever emergency treatment is required for you at home, be conscious of it, and it also helps you notice what are the changes, unexpected changes that are happening inside you.
True,
uh,
true.
so 23.1% men and 22.6% women above 25 years suffer from hypertension or high BP. I was reading that for women, especially, pregnancy, menopause, and birth control pills are common reasons, and
Hmm.
otherwise, it's a mix of bad food habits, sedentary lifestyles, lack of exercise, etc. What are the
Right.
medical conditions high BP is related to?
No, you're absolutely right. That actually, I look at it this way, that both in men as well as in women, faulty lifestyle is at the background. There is no doubt about it. Because we used to say when we were med students that during a menstruating period, the women had less. It's no longer. Now women are upfront. They are walking shoulder to shoulder with men, and obviously their stresses are there to go up in life, ambition, things like that, and also there may be some smoking or high salt intake. What you have said is important. Menopause and pregnancy. Now, pregnancy is a totally different situation when the blood pressure goes up, and we should not deal with it right now. But as far as menopause is concerned, obviously it increases. You should be more aware at that time that your blood pressure is likely to go up because of the absence of the hormones which are actually helping you in the meanwhile. And don't think that it is just the female body which is causing it. You have to look at it that your faulty lifestyle is also. I do not differentiate between the genders. I say, look, it is faulty lifestyle at the very beginning which causes it. As far as you said about what conditions, those conditions are coarctation of aorta or renal artery stenosis. Those are not, those are there, well defined. But the blood pressure that we are talking of right now, which you said was almost 29.8% in our country, that is because of obesity, because of faulty lifestyles, increased salt intake, not physically being active, and as you very rightly said, stress. So now you can share with us, Ashaji, lifestyle changes, which we are all wanting to hear.
Yeah. So, lifestyle changes, as you just said, regular physical activity is a must, about 30 minutes a day, which can help lower your blood pressure if you already have high BP. And it's also important to be consistent, especially as you grow older towards menopause for women and the middle age, as we call it, for everybody. But not only that, we can also do yoga, which is, I mean, the benefits of yoga cannot, they are endless. And so are benefits of meditation because they help you calm your body and your mind. And especially in today's age and date, added on with the COVID pressure, there is so much stress and anxiety, and you have to work on your emotional health. And self awareness is very important. You have to fight addictions, avoid addictions. Another thing I want to add on is that a lot of gratitude helps because you become more calmer and become more accepting. Apart from that, as Dr. Kasliwal said, a healthy diet, a healthy lifestyle in general. Obesity is another major cause, Dr. Kasliwal, we were discussing, because weight increases your BP, and that brings on other problems as well. So we need to keep a food diary. A healthy lifestyle includes sleeping in time. A lot of your sleep apnea is a major cause, which we are going to discuss about slowly. Again, salt intake is very important. How much salt you're taking in your body, alcohol, smoking, caffeine, all of them are important factors which lead to high BP. Uh, Home monitoring of BP is very important because that can result in, again, high BP and potential other health complications as well. For our audience, please type in your queries in the comment section below. And if you're finding today's talk useful, please give us a thumbs up. And I want to ask you, Dr. Kasliwal, what is the cause and what is OSA, which is obstructive sleep disorder, obstructive sleep apnea, its causes, treatments, and cure?
Archana, can I go a step backwards for a
Sure.
minute? You used a very good word, gratitude. A motivational speaker from the United States, Nick Voete, I can't pronounce his second name so well. He said a very good thing once. Don't have attitude, have gratitude. This is exactly what Mrs. Malhotra has said. Have gratitude. Don't have an attitude. This means that, and be positive. These are things which are not just important for control of blood pressure, but but just important for life itself. Now, many people talk of mind-body connection. Let me define today what is the mind-body connection that we are talking about, which Mr. Malhotra very rightly put that chronic stress. What is chronic stress? Chronic stress activates our hypothalamic pituitary adrenal axis. And that causes secretion of cortisols, glucagon, renin-angiotensin systems. And these are the things which will actually result in high blood pressure, high blood sugars, and they will also have a milieu which is proatherogenic, meaning the arteries can get stiffened and the arteries can get blocked. So talking about stress is not just emotion. It is actually how your mind is acting at the hormonal level and actually causing a problem. Also, these hormones causes increased sympathetic activity, cause increased heart rate, all these things, and platelet reactivity. These are all bad for the heart. And she'll come to that, how yoga decreases these levels of dopamine, increases the levels of serotonin. So again, yoga is not just an emotional thing that we are the country who started it. And no, there is our gurus of the yesteryears, of the era gone by, defined it very well, which now with modern medicine, we can say this is what is happening. That's why yoga and meditation, which you very rightly defined, causes decrease in blood pressure, makes us more calmer, decrease, and it decreases the inflammatory molecules. You just heard of cytokine storm in our COVID era. Well, these are the things which yoga does.
And obstructive sleep apnea,
yes.
Between 55 and 60.
Yes. Obstructive sleep apnea has been not so well defined as a risk factor in our communities. Neither many of us don't ask, and also the patient or the patient's spouses also never, until unless we tell them that, look, does your husband snore at night? Then they will say, yes, they snore. Then there is a small period when the sound disappears, then starts again. This could be a manifestation of obstructive sleep apnea. And if it's central obstructive sleep apnea, it can definitely cause increase in blood pressure. Those, of course, who have heart dysfunction or have rhythm disturbances, for them it can be devastating because they can have a problem in the night. But definitely it is very well known that those who have obstructive sleep apnea can result in hypertension. So It's not only chronic stress which builds up, it's also these, and then it becomes a vicious cycle. If I get up in the morning, I'm not comfortable, I have not slept, I'm going to be irritated, I'm going to create more stress to myself and more stress to the people around me. So, so obstructive sleep apnea, oftentimes misunderstood, but should be now in the forefront of our community. And again, as you said, obesity, big cause for that. Short neck, not exercising enough. And in this time when many people are actually inside the houses, their weights may have increased a little bit. Obviously, it will exaggerate sleep apnea. So, sleep apnea is so. With this, I would actually request you that now that we have opened the Pandora's box of stress, sleep apnea, stress again, acute stress, what would you tell the people that look, if you have to save yourself from high blood pressure, this is what you should be doing. Forget the medications and other things.
So I feel that there is so much of chronic stress around, and we add on to that. I mean, it's not just the medical issues that we have. There is our work, our job stress, especially in these times. The family pressures, the family finances, they suffer. There is illness. So what all can we do to reduce stress? Well, we can try to maintain calm, as we discussed, with physical activities, yoga, meditation. But apart from that, on human emotions front, I feel that we can try to lower our expectations from people around us, and we can focus more on issues that really matter, so that when we are focusing on solutions, we are automatically focusing less on complaints, less on other issues which distract us. We are focusing on what we need to do instead of what the other person needs to do. And I think that will reduce a lot of stress for all of us, people like us. And then we need to identify triggers which trigger of stress in you. What are the points? Where are the patterns in your mind? What is the where do you lay more significance? Try to be mindful of where you are putting more stress, where you're adding on to stress, where it's not required, and how much can you do activities which you enjoy with your family, with people around you. Even, I mean, although we can't meet people all that much like we used to do before COVID, but we can still connect online. We can connect with people. We can try to stop blaming other people, stop complaining, and practice gratitude. I mean, the art of giving is, I think, the biggest. It can be the most beautiful activity, the most beautiful thought, which can help you reduce your stress, because you see people around who are suffering much more than you. Again, for people who are who have real problems with stress, I would say take support of your family, your friends. I mean, encourage each other to talk, to share, and be actually their well wishers, rather than give them a proper listening ear and a guiding force. And for people who really need help beyond a point, encourage them to approach uh, you know uh, coaches, counselors, doctors, psychologists. Encourage them to take professional help, because that can really boost their morale, get them out of their emotional condition, and help prevent the medical issues that we are just discussing about. So, Doctor, I want to also touch upon here another thing, Dr. Kasliwal. How I've heard of the DASH diet, the dietary approach to stop hypertension. So, as per your suggestion, the next online I'm going to get is Tina Sapra, who's a very prominent dietitian. But I want to ask you, what is the dietary approach to stop hypertension?
This is a diet, it seems as if it was made in India because they have emphasized the use of vegetarian food, which may or may not be, but they've emphasized that you can. The dietary approaches to stop hypertension is a very clean thinking that you take vegetarians with not just vegetarian diet, you can take non-vegetarian, but substitute salads, legumes, fruits, and do not add salt from, don't sprinkle salt, try to take salt See, 1 teaspoonful, if you flatten it, has 5 grams of NaCl, which approximately gives you 2.4 grams of Na, sodium. That should be okay for the entire day. Then there is another variant of the DASH diet. It's called DASH salt, in which they've actually asked people to gradually come down to 1.5 gram of sodium in the whole day. So, and also they emphasize that apart from substituting many things with vegetarian food, they also say that when you try to take as less processed food as possible. But if you have to take, sometimes you want to increase, change your taste. Do read the it's very well what's written on the wrapper of the food, that what is the salt content. That is very important. So this is the dietary approach to stop hypertension, which is based not only just on salt decrease, but also on overall indulging in vegetables, MUFA, that means MUFA and PUFA, polyunsaturated and monounsaturated fatty acids, keeping away from uh, trans fatty acids and these things. So if you're taking nuts, for example, if you're taking vegetables, you're actually taking in, and if these are cooked in oils which are not high on saturated fats, that's what DASH diet is. You will be surprised that this DASH diet was actually started some 40 years ago, and still, whenever a medical student reads the chapter on hypertension and the non-pharmacological approach to control hypertension, the first thing he will read is DASH diet. And then he'll wonder why. What happened all these years? But the diet was so good. It is not about vegetarianism or non-vegetarianism. No, it's just about saying that you can increase more vegetable food, you can decrease your salt intake, and inbuilt into this whole concept is, as you very rightly said, 150 minutes of regular physical exercise per week. That's all
Per week.
people are asking for, nothing more than that. One thing I may add here is something called NEAT, non-exercise activity thermogenesis. Meaning, like Mrs. Malhotra, we both are sitting in two different places, but we are sitting. Why aren't we standing? We could have kept our computer on a podium, and we could have then moved about a little bit. These things help. Going to a restroom which is far away, because many people do have a job which has to be in front of their computer screen, and nothing wrong with that. But many variations can be done on that. So NEAT,
Alternative study.
yes, NEAT is a really good concept, and many countries, many restaurants. Of course, now everything is closed, but they feel comfortable serving you like that. So I think overall, we have to make up our minds that it's about good physical activity. Even if you're doing some work after doing your moderate physical exercise, if you are pottering in the gardens or taking small walks to get the grocery, it helps. The number of steps you take helps. That
That's
is
true.
what, yeah. And also, once you decrease your weight, you will see you become from metabolic to normal metabolic, and you will see your blood pressure will show a favorable trend. We as doctors do not want to give you medication to start with, but except when you come at 200 or 190. But if you are in that range between below 140/90 and above 120/80, we say, guys, you have a great opportunity that this may be labeled as pre-hypertension, and that's where we should do. So coming back to what we said originally, men over 25, women over 30, if they first took their blood pressure at that age, you won't get blood pressure. And then you start seeing your diet, how much salt you're taking. We are also very snacky people, by the way, and snacks are full of
And they're full of
salt.
salt.
Full of salt. So these are the things which are so simple. But one thing which you have said, is a very valid point. One about gratitude. The second thing about positivity. It's easy to say it, but in a difficult world, 21st century is difficult. This era we are passing through is difficult. However, there are, I was seeing a video today how people are going out giving food to stray dogs, and you should see the amount of love and affection they were getting, or just feeding the birds somewhere. Can you imagine? This person is vasodilating. He will get his pressures down in no time at all. These are the things what you have referred to as gratitude. That's what how I take it as.
No, everything in our life, I mean, we can come back to it and we can always see gratitude because we're looking from that eye. And when if we are in the complaining mode, then we forget. So we rather have the gratitude take over that, so that
Mm.
that kind of eases our mind of so much more stress. And
Yeah.
as Dr. Kasliwal said, a lot of it is in our hands, whether it's diet, whether it's how we think, what we think, the act of gratitude, our positivity in life. A lot of it is in our hands, and let's try to handle that than totally depend on medication.
Yeah,
Uh,
absolutely. Yeah,
yeah.
absolutely. But obviously, if your pressures are so high, first is to bring it down, keep it down, and then start rethinking your life. Start thinking, because if the stiffness of the arteries has taken place, one of the questions people ask me is, now that you have given me medication, I will be on meds for entire life. No, it depends upon you. If you get off salt, if you get off alcohol, if you get off and you exercise, change your attitude, don't not get upset at small things. As you said, acute stress and chronic stress. Obviously, I will say, yeah, decrease your medication. I've just done that today on a very prominent person.
Yeah, yeah. So I will ask some questions from the audience now, Dr. Kasliwal. Uma, Kapil, they are saying hello. Thank you for being here. They are our supporters. Rakesh Gupta. Rakesh Gupta is asking you, when high BP is inherited, can something be done to control it or reduce it to allowable level?
Very, very good question. This is a very good question. Even if the blood pressure is inherited, that has loaded your gun, it has not fired the trigger. So, if you know that one uh, parent or both parents will have, the parents should start giving their children low salt right from the very beginning. I'm not saying no salt. I'm saying they can be on decrease. And they are the people who, at the age that I've been mentioning, should get their blood pressures checked up. They should not get arterial stiffness, which can also be measured. It is not necessary that if my parents had high blood pressure, I'm going to get hypertension. No, they asked me to control it from the very beginning and said, look, you may have a genetic predisposition, but if I have been regular with my exercise, if my weight hasn't increased, if I don't sprinkle salt unnecessarily, of course, I come out of 45 degrees, I will take a little bit of salt. Then then if my parents are hypertensive, I may not become a hypertensive. So, so good question. When BP is inherited, can something be done? Yes, a lot of things can be done. To why control it? To actually not that you may not even get it. So that's my answer to this question.
So Ekta and Savitri, hello. Aryan is an amazing session. Thank you, Aryan. Thank you, Anurag, for helping me set this up. Let me also express my gratitude here. Now that we are talking of gratitude, Nagender Singh is saying gratitude is a big word,
Hmm.
and
If
you
you
can
can
imagine.
imbibe this in reality,
Sorry.
he says that if you can imbibe this in reality, then you become a true human. Thanks, Archana, for such lovely discussions. You're doing a wonderful work. I think
Oh,
you
Dr.
totally
Kasliwal.
deserve it. Yeah. No, this is a great word.
Yeah. Nanda is saying, does low BP also cause major problems?
No, if the low blood pressure is a natural thing, that means then people would want to have, because then your vascular age is very good, your arterial stiffness is not there. But If the low blood pressure actually causes you giddiness or weakness, then you are one of those lucky people who can actually add salt to your diet.
Mm.
But if low blood pressure is occurring in the realm of loose motions or diarrhea or heart attacks, then it's going to cause a major problem to the doctor how to bring that up. But
Yes, normally, sorry.
normally, low blood pressure will be seen not as a disease, but as something that happened to you, and you can take care of it by. See, in elderly age group people, or any age group for that matter, low sodium, low sodium in the body can actually present to the doctor as somebody having a stroke or something like that because they're just listless, just lying there. They can't move. So don't go to those levels of low sodium. Take care of yourself. Mr.
So,
Gupta was asking, yeah.
sorry, Rakesh Gupta, not try to be a perfectionist. So, peace means less of stress for those remaining at peace.
No, I don't think stress should come into our way of either getting more ambitious or becoming a perfectionist. Why? Because we have all stressed on bad stress, but there is also something like good stress, which goads you to a higher level of where you are. If you did not internalize your problems, if you discussed with people, if you were more open, well, what is the problem if you want to become from assistant professor to professor? It's not a natural phenomena. And you should try to give this to your students or to your family members or to your community. So I would say that in our path to attain something better, something bigger than what we are at this moment, stress should not come into the way. But that good stress should make you think clearer, give more time to the family, but also keep time for yourself and become a perfectionist or whatever you want in your profession and move up also. That's how I would look at it. That I would channelize this bad uh, hormones which are coming out in the body. I would channelize it into making me to a different level. Give you an example. When our child is going for class 12 examination, uh, what do we tell them? Take it easy, read your question paper and do it. But he's not the same guy for those 3 hours. He's somebody different. If he was just the way it was, he would not be a 95% attainer. Not that we are pushing into it, but everybody wants to attain something in life. So the stress, the power of the stress can actually help us to attain a much bigger level without us getting high blood pressure, without us getting coronary artery disease, without us getting arterial stiffness. That's the way I would look at it.
So, Anurag, is some tips to on quick techniques to help ease stressful situations.
Asha, there's something going on with your voice.
So, Anurag's asking, can you give us some tips on quick fix techniques to help ease stressful situations?
That question is for you, so you'll have to answer. See, it's a very simple thing. You have to take all the difficult questions, right?
That
You're
question
having
is
a
also
conversation.
my husband. So I think we can discuss it offline. But yes, for people to help ease stressful situations, it is better to let go, to be calm in situations, to avoid, to stop the blaming, to stop complaining, and again to practice gratitude, like we said. But at
Yeah.
the same time, I feel disconnecting from situations is very important. Your positive outlook is very important, as already is practiced. So that positive outlook helps you get more positivity out from yourself and from others around you.
But Archana, I also feel that running away from stressful situations or stressful questions is also not a good thing. That will make an acute stress into a chronic stress, and then you are going to have more problems. Catch the bull by the horns. All of us are going through difficult phases, particularly at this time. So, but be calm and say, look, maybe I made a mistake. Maybe I'll ask my senior, I'll ask my boss, what did I do wrong? Or that he did something wrong and blamed it. So these are situations where, again, calmness will help, a mindfulness will help. But don't think that the entire world is against me and I don't know what's going to happen, cringe inside. No, that will give you high cortisol levels. That will give you hyperglycemia and hypertension and decrease your serotonin levels. Don't do that. Take it by the ball. Don't postpone anything for the next day if it can't be. And in my arena of work, it can't be. I just have to call somebody at 2 a.m. and say, look, did this happen? Why didn't we do this? Otherwise, it goes on perpetuating.
I agree there. It's on handling the situation when it's small rather than letting it roll into a bigger problem which comes and hits you more.
Yeah, more. Exactly.
Very important. So Uma's asking, are BP medications habitual?
Yes. So I partly answered this question in the sense that uh, if we did our married the lifestyle with the medication, then the medication will obviously come down slowly over a period of time. A small something may continue because the medication is helping us not getting a heart attack or saving our kidneys or saving our brains. You know, one of the things which uncontrolled high blood pressure can do is cognitive disorders,
Mm-hmm.
tremors. Who wants to have that? If I have to just take a pill, but that pill should not be on the basis of not doing my physical
Your
activity.
lifestyle, not
Yes.
practicing your lifestyle changes.
Not,
Exactly,
yes.
definitely. Yeah.
Then
So
her question is correct that even with doing all those things, sometimes I will tell you that, sir, don't leave your medication. It can cause a problem.
yeah. So Amit Banga is asking, I generally have lower BP. I've been told it's healthier, but how low it can go before I should get alarmed?
See, his first sentence is absolutely correct. Lower BP is healthier, no doubt about it. But if the pressure is below 95 and he cannot keep up with it, meaning he gets tired or he gets dizziness, then don't get alarmed. Just take a little bit of salt. You're in a happy position. So don't leave it.
It's a better case to handle with high BP.
Yeah. He's not a case at all, so that's better.
So Neha's asking, how is stress related to high blood? We already discussed that, Neha.
Yeah.
Stress is related to high BP. We can handle stress.
Mm.
We've already discussed that. Danda is saying thank you. So Naresh Malhotra is saying a
Mm.
good discussion. I have reduced my medication for BP. Good to know. Always good to know. Anuradha is saying thank you to you. It is always great to hear Dr. Kasliwal speak. Of course, he gives us such great value. Uh, Savitri is also thanking you. And Rohit Dhawan is saying, a very informative discussion. Thank you, Rohit. Sonia Malik is asking, is there any relation between high BP and pulse rate?
Yeah, that's a good question in the sense that many people under stress will also have high heart rates. So that actually we didn't discuss. But heart rates can also be high because of the effect of the bad hormones that are secreted in the body. And but generally, round of the mill patients that we see with high blood pressure, their pulse rates may be the same. But in some situation, particularly in younger individuals, we find high blood pressure and high pulse rates go hand in hand. So we do give a small dose of a beta blocker and then, of course, the conventional medication. But sometimes uh, the high heart rate gives me an indication that this person is actually under stress. And if he or she reduces the stress, we can bring down the medication because if the heart rate is high, it's an indicator. Either it's because of nicotine, or it's because of tobacco intake, or it's because of stress. So, but pulse rate being high is not a good thing because it will ultimately affect the heart far sooner than blood pressure. So, good
So,
question.
yeah, good question. And Jyoti is asking, how can I quickly lower my blood pressure? So there is a time between when it's happening and when you reach the hospital for your emergency treatment. What should you do in between?
No, so if the person's blood pressure was that high that the doctor said, look, it's not safe for you to be at home, but you should actually be in the hospital, then of course we will try to quickly bring down your blood pressure as fast as we can, maybe overnight. And then we'll put you on medication, which ultimately over a long term, over a week or so, will get your blood pressures down, and then you enter your usual life pattern of going to office or whatever you do. And then we decide that look, what were the risk factors, what happened that night that the patient's blood pressure went up, and do the relevant investigations. Sometimes you realize that all this was acute stress and nothing else.
Uh, Amit is asking its levels and age of meditation and breathing. Thank you, Amit. Kamini is asking, are there any sports or activities I should avoid in high BP? That's also a good question.
That's also a very good question. So first get your blood pressure controlled. See, there is something called ambulatory blood pressure monitoring. So in many people, we tell them that your blood pressure is controlled in the hospital setting. Now you want to hit the treadmill, and rightfully you should. So we will give them a small instrument which will take their blood pressure for 24 hours. And while she's exercising, while she's on the treadmill, while she's on a stationary bicycle, we'll go on taking the blood pressure. That instrument will go on. Next day, we see that with drugs, how much it comes down, what happens when she's exercising, is she doing the right thing, or we need to step up or step down her medication. So it's a very good way by ambulatory blood pressure monitoring. That's a very good instrument, non-invasive. Again, you just have to put it on and go about doing your work.
Mr. Ajay Syal is asking he's saying very informative session. Thank you, Ajay. And in view of ensuing times that are challenging for all, yes, definitely. And thank you again, Dr. Kasliwal. So Meeta is asking here, what quantity of salt is good in a day for high BP? Would no salt in dinner help lower the BP?
So let me answer the second part first. I mean, generally, it's not a good idea to have no sugar and no salt. Yeah. What quantity of salt? As I said, you take a teaspoonful, level it, and you can take 2.4 grams every day. Now, the reason I'm saying this is that we are in a very hot country. We may be in an air conditioned atmosphere in the hospital, I mean, at homes. The minute we go out, particularly half sleeve shirts, it's 40 degrees outside, we are losing salt. So, if we are taking no salt, we are going to fall down or be very weak with the medication that we are on. So that this insensible loss of sodium can actually create a problem in our country or any country for that matter. So, which means that try to take very limited amounts of salt. I actually, to most of my patients, I say don't add extra salt, but take whatever. One thing which I found in many families that they were adding salt to the atta. So, so
It's
yeah. So, and as I was being prompted that I must speak about APC, avoid achar, papads, and chutney. These are things which have got high salt intake. When we were children, our mothers used to give us pudiyas of APC whenever we had some pains in the body. They would say, "Yeah, take APC." Now that APC has been changed to achar, papad, chutney, so avoid that.
so. There is another question, the last one from the audience. Does lower BP mean lower chances of heart disease and blockages? Amit is asking.
Yeah, generally, if the pressure is low, then your arteries are not under so much stress. So arterial stiffness will not be there and definitely decreases your chances. It doesn't nullify them, but definitely decreases it. So I think many people like Amit would like to know about low blood pressure. Again, let me reassure you, low blood pressure in the home setting is not a bad thing at all, but it changes dramatically if you have a disease state.
So I would like to say to our audiences again, do forward this to someone whom you think can benefit. And if you love today's talk, please subscribe to my YouTube channel, Archana Malhotra, for more such useful information. My last question to you today, Dr. Kasliwal. An incident happened with a friend's father recently when he was probably having a heart attack, and he was rushed to two hospitals who refused to accommodate him before he took a COVID test. The second hospital then luckily gave him emergency treatment, and he was saved. But he could very well have lost his battle. Now, I mean, the results don't come out immediately. So, what in this case is the protocol that hospitals follow, and how about Medanta?
So at Vedanta, the protocol is absolutely correct. If you reach some with chest pain and the ECG shows ST elevation myocardial infarction, what we call as a STEMI, then what they will do is they will take the blood sample definitely for COVID testing, but before that, they will give you a drug called the clot buster. So at least your treatment has started. You are put in an ICU where you are looked after as you would be anywhere else, but you will get all the required treatment. As soon as that COVID test comes back, which the gold test will come within even 2 hours, you will then be shifted to the main ICU, which is the cardiac ICU, and then from there treatment will go on. But no patient who has a cardiac illness will ever be refused. I've had situations where my associates have actually donned a PPE even for half an hour and put temporary pacemakers or have done emergent angioplasties in such critically ill patients or put intra-aortic balloon pumps. So most hospitals have a protocol that what do we do under this, and these protocols have now been actually seen are being followed in most hospitals around the world. This is what the Cardiological Society of India has said. This is what the European Society says. So no patient is refused because this is the time they need us the most because they're under stress of all kinds. The people, their attendants are under stress that we don't know what's going to happen. And many times we say that the attendants also say, "कि sir, हमें भी test कर दीजिए आप," while you are testing him. So that's the level of education. Sometimes people are very good. They know that they're in trouble.
Yeah. So, the end approaching the I would like to share that Dr. Kasliwal was sharing the other day that the mission statement of Federation of Hypertension for this year is measure it, lower it, and live longer. And we've discussed on causes, symptoms, what we can do medically as well as non-medically to help ourselves.
Right.
I take your permission now. I will end this session. A big thank you for your precious time, for coming again and sharing very, very valuable information, Dr. Kasliwal. Thank you.
Thank you very much.
Really,
Thank you.
yeah.
Yeah, thank you
And
very much.
thank
And
you.
thank you to all the people who are listening to us and those who have asked questions. Thank you to them because that's what makes the show an important show in conversation. So thank you very
Yes.
much. I'm
And we want
honored.
to share as much information and value with everybody. Thank you, everyone, for sharing your questions, your views, and for sparing your precious time to come and watch In Conversation. On 31st July, Friday, 6 p.m., our guest is Tina Sapra, as Dr. Kasliwal suggested that, you should get somebody who helps us manage our diet. Basically, she's into obesity, diabetes, and hypertension, and she has a clinic called Dr. Diet. So we shall see her, we shall ask our questions, and do send your questions, please. Have a great evening and a great weekend. See you on 31st in Conversation.
Thank you.